Hello, everyone. We're here today to talk about hospice. I'm Lisa from Happier at Home Care, and our guest here is Beth Hohberger. She is a senior hospice care consultant from Compassus Hospice, and we often refer to her with our questions. And so today she's going to answer some questions for us. So how are you doing, Beth?
Well, thank you for having me. I really appreciate the opportunity to discuss hospice and care issues and some myths of hospice as well.
I think the number one question we get from families is who pays for hospice? How does this cost get absorbed?
That's a good question. Hospice is a free benefit. It is paid through your insurance via commercial insurance or your Medicare insurance. So, of course, insurance has to be verified. And then through the hospice Medicare benefit, if it's managed Medicare, it converts back to your traditional Medicare. So it costs the family and patients nothing. This is a benefit that they've earned. They're entitled to this.
So what if someone has an HMO?
Then it reverts back to their managed Medicare, would revert back to their traditional Medicare for hospice.
And what does that include? Does that include a nurse?
The hospice is it's an array of services for a patient who has approximately 6 months to a year less to live if the disease runs its normal course. So the benefit includes a nurse to come to wherever the patient lives. It could be your home, it could be an assisted living facility, a personal care home, memory care, or a nursing home. And it includes a nurse, an aide, a social worker, a chaplain, a bereavement coordinator, volunteer coordinator, and then, of course, when someone does pass away, we follow up for 13 months after passing to make sure that the family and the extended members, they're getting support through their bereavement and to help them through the first of everything, the anniversaries, the birthdays, to help them through that process and their grieving process as well.
Wow, sounds like you guys do a great job with covering things. How about equipment?
The equipment is covered as well. Durable medical equipment is covered. That is needed in, again, wherever they reside. It could be a wheelchair, a high-back wheelchair, walker, bedside commode, all those things that are to keep them comfortable. They're all covered by hospice.
Wonderful, wonderful. Another common question we get is, does someone have to stop all of their medications when they're on hospice?
Exactly. No, they do not. That's a huge myth. Of course, depending upon where they are in their disease prognosis, if they're not swallowing, we are going to maybe recommend to discontinue some of the pills. But however, they do not have to discontinue any medications that are for comfort. We do review everything with the patient and the family, what they're on now, what they may need to be on, or what we may recommend to discontinue. But no, they do not have to totally discontinue medications to be eligible and to be admitted to hospice.
So how do we know when someone's eligible?
That's a very good question. Unfortunately, as I said, the disease is approximately 6 months to a year or less if it runs its normal course for the benefit. Whenever you see a decline and they're just not maybe eating as much or they've lost a lot of weight, there's so many variables clinically that would be appropriate. You can always ask the doctor for a recommendation or just to call us. You don't need to have an order to have a conversation to come out to evaluate a patient. We would need an order for an evaluation from the physician. However, they could be having just a lot of weight loss, garbled speech. They're not communicating as much. You see a true decline.
So it doesn't have to be just for a cancer diagnosis.
Correct.
Okay, can you provide your phone number for us?
Sure. My name again is Beth Hohberger. I'm a senior hospice care consultant with Compassus. My work cell, I should say, is 215-499-8759, and our office is 215-557-7300. And I'm always available to just have conversations regarding end of life and goals of care discussions as well. It would be very helpful to your patients and families, just so they know what they're looking for.
Great. Well, thanks for being here, Beth.
Thanks for the opportunity.
Appreciate it.